Alrighty, so we are going to go over chapter 14, our last chapter. We have made it to the end. So we are going to review death and dying. So, concept of death. Death is unfortunately an inevitable part of our life. There's two things sure about life that you're going to pay taxes and you're going to die. That's the only two guaranteed things in life, right? So, it's an inevitable part of our life. It's a very personal issue to deal with. People are going to handle it very differently. Significant losses in someone's life can affect a person's priorities. It can change the way that they think about things. It can change how they look at relationships. If you have had a loss in your life, it really does make you look at life in a little bit different way. It makes you realize how precious life is and that we need to, not take it for granted. So it can really affect all aspects of a person's life. How someone manages and copes with loss is determined by their own coping mechanisms and how they're able to cope with things like that. When we're talking about grief, this is described as a feeling that is in response to a loss or death. So again, grief is described as feeling that is in response to a loss or death. It's a very painful process to go through. Anticipatory grief. This is grieving before the loss really occurs. So this may happen if someone is terminally ill, maybe they have a really aggressive form of cancer or something like that. We may begin grieving before the death actually occurs. So we start that grieving process before the person has even left us. That would be anticipatory grief. Maladaptive grief. This is a very exaggerated, drawn out process. This individual is not dealing with grief in a healthy way. These people are probably going to need some type of emotional support to get them through the grief process. Mourning, this is a natural process we go through after a loss. It's just us adjusting to a loss and our new way of living without that person. So just kind of navigating how your life has changed and how life looks now that that person is no longer in your life. This can be a short process or it can last for years. It's going to be different for everyone, like I said, de- depending on how they cope and things like that. The outcome or the goal at the end of mourning should be to return to a pretty much normal life. Bereavement, this is the state of having sustained a loss. So that's just the state of, you have sustained a loss or a death of a loved one. That would be the period of bereavement. Next, theories of loss and grief. So, Elizabeth Kubler-Ross was a psychiatrist. She identified 5 stages of death and dying that patients and families go through. These 5 stages can be gone through in any order, but this was the order that she had put them in. Stage 1 is denial. So, this is when the patient or the family believes that there's been some kind of a mistake. The doctor is wrong about the diagnosis. They have read the scans wrong, something, it's not true. This is very common in unexpected deaths, deaths that are very sudden, something that wasn't expected. The family is going to be left in a state of shock. They don't believe that the death has really happened. They are blocking out that information. They don't accept it as reality. Stage 2 is anger. Anger occurs when they understand the truth about the death. So they understand that the death is real and they get very angry about it. Or they can also have anger from learning about impending death. They may turn their anger inward. They could also displace their anger onto someone else, maybe the physician who told us the news. It could be the nurses, or sometimes people even turn their anger towards God. Still must be able to treat these people in a respectful and compassionate manner, even when anger is being directed towards you as the caregiver. We still have to be able to compose ourselves and treat these individuals with compassion. Stage 3 is bargaining. When they know death is inevitable, they may try to make a deal with God to get more time with their loved one. So maybe they will pray for extra months to live. They're trying to bargain in any way to get extra time. Stage 4 is depression. This is a feeling of sadness or loneliness that occurs. They become more quiet and withdrawn. And then stage 5 is acceptance. The final goodbyes are said. They are more accepting and understanding of what is happening. All right, more theories of loss and grief. John Bowlby also created stages of separation. So he studied child's reactions to separation from their mother, and he noted similarities between that process and also the patterns of adult grief. So he described a child's initial reaction to separation from their mother as protest. The child is very upset over the loss, they're very emotional, they cry. This stage can be seen very similarly in adults as their first response to a significant loss. Stage 2 is despair. The child may become very quiet, sad, withdrawn, may show little interest in things, may refuse to eat, may even lose some weight as a result of that. Again, similar process happens with adults as well. Stage 3 and the final stage is detachment. At this stage, the child is kind of disinterested in the mother when she returns. It shows that they have accepted that loss and they have moved on with their life, and so they're not really interested in that relationship anymore. Bowlby then created a theory of mourning using his previous theory of attachment. So stage 1 is the numbing stage. This is a protective mechanism. It helps us deal with the loss. Stage 2 is the painful stage. So the individual faces the magnitude of the loss during this stage. They have a tremendous longing for the deceased person. They wish to be with them again. Stage 3 is disorganization and despair. People feel anger over their loss and want answers as to why this horrible thing happened to them. Why me? Why did this have to happen to me? And stage 4, reorganization. This is when they're adapting to their new life. They may require a lot of support and encouragement from family and friends during this time. Types of losses. Losses can be predictable, other losses can be very unexpected. Physical losses are those that are visible. So that's like the death of a loved one, a spouse, a parent, a child, something like that. Symbolic losses are not as apparent to the outside world. This is maybe the loss of a job, loss of a relationship, a divorce. All losses, whether physical or symbolic, make us go through a grief response. So, loss of a spouse, this is a huge impact on an individual. They must learn to deal with loneliness and the change of their roles, especially if they've been married for 50 years and now all of a sudden their partner in life is gone. That's a huge change in how their everyday life looks. Men and women do handle death of their spouses differently. Men typically lose their spouses later in life, whereas women typically lose theirs earlier in life. Loss of a parent. This is a big deal for the child at any age. Young children need to be encouraged that they are not alone, they are still loved, and they will still be taken care of. Older children also need to be sure to feel love and support from remaining family members. Losing a parent as an adult, this may be anticipated. Of course, our parents age, and we know that it is inevitable, but it is still very hard to deal with. They may have to begin looking after the surviving parent more. So, maybe the mom died unexpectedly and she always cooked every meal for her husband. That may be something that surviving adult child may have to help their father with, if he's not had to provide that, or maybe he's not able to. Loss of a child. This is considered one of the most difficult losses to go through. We hope our children will outlive us, and it is almost unbearable when they don't. I cannot imagine the hurt that goes along with this, and I do not wish that upon anyone. Parents are left with extreme despair, disbelief, and anger. Often they want to place blame for their child's death on someone or something. We look for something to blame for why this horrible thing happened. My cousin passed away when he was 23 in a car accident, and my aunt, the grief that she went through watching that, I believe I was in 8th grade when that happened. But still, I just remember seeing the immense grief that my aunt went through watching, losing her firstborn, her son, was just awful. I cannot imagine. Loss of an unborn child, again, another really significant loss for parents. This may be a miscarriage or a stillbirth. Very difficult no matter how far along the pregnancy was. With deaths that are close to term, really important to allow the parents to see and hold the child, but we do want to prepare them beforehand if they are malformed or even just a deceased child is going to look different than a living child. So maybe what they look like, their coloring, what temperature, they feel cool, they may be a little bit gray looking. We want to prepare them for what they're about to see. Even children that have deformities, the parents report still being glad that they could see their child, and it wasn't as bad to see their deformed child as what they would think it would be. Allowing them to see the child gives them a sense of closure. Of course, if the parents do not want to see the child for whatever reason, we don't want to, try to force them, but it is common that they would want to, and we should encourage that. Loss of a sibling, again, painful at any age. Children may blame themselves for their sibling's death, find it unbearable to move on without their sibling. That's kind of their partner in crime, so they can find it really difficult to move on without them. They must deal with their own grief and how their parents are grieving also. So if they're the kid that's left, the parents are obviously going to go through their own grieving process, so the child may kind of, you know, unfortunately get put to the wayside a little bit as their parents are grieving and learning how to deal with this as well. Adult loss of a sibling can cause a feeling of emptiness, causes a break in that family chain. Again, have to adjust to a new family structure. Unexpected loss, this is any sudden death. That can be shocking to loved ones to have an unexpected death. Suicide is especially traumatic on family and friends. There's no time for goodbyes. There's a lot of feelings of guilt that they were unaware of their loved one's pain or their plan to hurt themselves. They had no idea that they were struggling that badly. So it can be extremely traumatic for the surviving loved ones. Facing one's own death. So this happens when someone is terminally ill and they are aware of their own impending death. How someone accepts this depends on their age, their religion, culture, personal beliefs about death, and the support that they get from family and friends. Older adults may make loved ones aware of their wishes for funerals, may prearrange a funeral, burials, how they want their possessions to be distributed, and things like that. Developing a concept of death. So, children's understanding of death is going to depend on what age they are and what developmental and cognitive stage that they are in. Infants have no concept of death. Young toddlers, they recognize that they are separate people from their mothers. For toddlers, their main concern is going to be separation anxiety. They really don't have any kind of concept or understanding of what death is quite yet. Preschoolers, they're more concerned about themselves and their own pain related to sickness and or injury. They may see death in movies and they may have experienced it in their own lives, but again, really don't have a good concept of what that really means. School age children, better ability to understand that death is final. They relate death to accidents, illness, or old age. They don't really see outside of those three things to cause a death. Adolescents, so they really understand that death is final. They understand the rituals that go along with it, but they see it as a very distant possibility. It could never happen to themselves or to any of their own family. It is a huge shock to them if someone their own age dies. It's very disturbing. When I was in high school, there was a couple of deaths in our class actually from one was a suicide, one was a car accident, and it's very shocking to go through that as a high schooler that someone your own age is passing away. Early adulthood. So during this time, we're focusing on careers and growing families. Their concern about their own mortality is risen again whenever someone their age dies or suddenly or someone becomes ill. They kind of think about their own mortality and their own chance of that. Middle-aged, focus on physical changes and losses, may have experienced a loss of a parent. They reevaluate their priorities of their lives and they adapt. They may have a newfound appreciation for life if they have someone close to them uh, pass away. Older adults, they realize that their deaths may be in the near future. They start verbalizing their wishes. They also are going to evaluate their lives and how they lived their life, what successes they had, kind of going back through and determining, did they live a good life or not. Cultural and religious differences. So, culture and religion guide families on how to react to death and how to handle the death of a loved one. Really important for us as healthcare providers to understand the patient's and the family's wishes when it comes to this. Helps us to know what to do to meet the family's needs or wants for their loved ones. It also leads to a better quality of care that we are providing to them. We need to be very open as far as communication goes about what their wishes are. And we also need to be asking about their wishes periodically because they can change with time. And as things progress or things change, their wishes and how they want things to be handled can also change. So we have to be very cognizant of that as well. Signs of approaching death. So these are signs that the person is becoming weaker and that death potentially may be near. No one can give an exact prediction of time for death. These are just signs that, again, it may be a near possibility. So the first one is they begin to withdraw from their surroundings. The they have a decrease in their senses, but hearing is said to remain until death. So that's why it's really important to continue talking to your patients and your loved ones even if they are in a really lethargic state or unconscious, sedated, whatever it may be, odds are they probably can still hear you. So, the floor that I worked on, we took care of hospice patients, and I absolutely loved it in inpatient hospice. And it's really, it was something really important to staff when we did have a hospice patient that we were very careful about what we said, even if, that patient's the only one in the room, very careful about what we said and how we said it. And we told the patient what we were doing. Even, like I said, they looked like they had no idea what was going on. We were still explaining to them what we were doing and things like that. Change in activity level, kind of two things that you'll see here. Either they become very agitated and restless, or they become very quiet and still. Change in breathing patterns, may see really irregular respirations, may see some periods of apnea. We call that Shine-Stokes respirations, Cheyne-Stokes, Shine-Stokes respirations. That's whenever, they may take a couple of breaths and then they stop breathing for a little bit, and then they breathe and then they stop. It's very an irregular pattern of breathing. Change in vitals, you'll notice that the blood pressure is going to really start dropping, the pulse is going to slow down. They lose their ability to control their bowel and their bladder, so they become incontinent of both of those. They have a change in level of consciousness. It's decreased, they're less alert, less aware of what's going on. Loss of heat, their body begins to cool down. Family is a big source of comfort, even if the patient shows little to no acknowledgement of them being there. Again, it just kind of seems like they're asleep, sedated, whatever it may be, they're not awake, but they still really find a source of comfort with that family there. And I have seen it myself. I know when they know that their family has made it, that these patients will be alone because maybe their family lives hours away and they're traveling to get here. That patient's been hanging on, and it's almost as soon as that family arrives and they kind of get their closure that patient passes on, they feel it's okay because their family's made it to see them. So big source of comfort there is family. End of life issues. Advance directives are legal documents that states a person wishes for medical treatment when they can no longer make their own decisions. Facilities must inform patients that they have the right to have this legal document in place upon admission. Every time a patient gets admitted, we ask them if they have any advance directives or if they want any information on any advance directives. We ask that with every single patient. Patient Self-Determination Act. This gives patients the right to have advance directives in place. A living will, that's a form of an advance directive. This states a person's wishes for life-sustaining treatment. A durable power of attorney for healthcare. This is when the individual appoints someone to carry out their wishes and make their decisions for them regarding medical treatment if they are no longer able to. We must have a signed document. It's a specific form that, you know, identifies who this POA is, and it must be signed by the patient and the POA. You have to be really careful. There's power of attorneys for more than just healthcare. There's power of attorneys over an estate, so they're in control of decisions related to their home and paying bills and, who gets the home and, things like that. So I've had patients' families bring in a power of attorney for an estate, and we could not accept that because it had nothing to do with healthcare. It has to be a power of attorney for healthcare. So be very careful of that whenever you are out working and you are getting documents from families that it is the correct thing. Okay, DNRs or do not resuscitates may also be called a no code. Again, we are going to ask this on admission if they want to be a full code or a DNR. It lets us know how the patient wishes for their care to be if they were to go into cardiac or respiratory arrest. So basically, are we going to resuscitate them or not? Ethical decisions. So ethical decisions related to death can be very challenging for families to deal with. Organ donation is one. Family is going to be asked to donate their deceased loved one's organs, or they could potentially be asked to donate their loved one's organs. Can be a very sensitive subject, must be very tactful when asking this. This is probably going to be a provider that does this. We should not be pressuring the family in their decision. The family ultimately has the right to choose regardless of the patient's wishes at the time at times. So maybe the patient really wanted to be an organ donor, but the family is ultimately going to have that decision, so they may choose not to. Euthanasia, aka assisted suicide. So this is purposely withholding treatment to end someone's life. Currently, this is legal in Oregon, Washington, and Vermont. It is illegal everywhere else in the US. Those are the only 3 states that it is legal in. This is a very hot topic. It's often debated whether it should be allowed or not. Right to die proponents believe that people should have the right to refuse treatment even though it can result in death. Palliative care, this helps in relieving suffering in patients who are terminally ill. It may ultimately shorten the person's life, but that is not the intention of it. The intention is to make the patient comfortable. Hospice care, also comfort care for terminally ill people, but this is more specific in their homes or in hospice designated units. Like I said, I worked on a medical surgical floor, but we had specific hospice rooms. So if we had any inpatient hospice patients, we had specific rooms for them to go in that, the rooms were larger, had more room for family. It usually had a table and chairs in there. It had a mini fridge, a microwave, because they could be in there for a few days, and family typically doesn't really leave the patient's bedside. So they were more appropriate rooms for that. Comfort is priority with hospice. So I'll say that again. Comfort is priority with hospice rather than taking measures to cure the patient. So we're not trying to cure them anymore. We're only trying to provide them comfort in their last days, weeks, months of life. Hospice care includes nursing, it includes social workers, physical therapists, and also clergy if desired, so priests, preachers, things like that. Hospice also provides counseling for families after a loved one's death for 13 months, which I think is super awesome. Here's your chapter challenge if you want to do a little bit to prepare more for the quiz. This gives you a good insight into main points of the chapter. And congrats, you made it to the end. I thought this was funny. So if you paid attention, this might be a question on your quiz. We'll have to see. All right, have a great rest of your day and congrats, you made it to the end.